Hi there, my name is Alexandra Belevins, and I'm going to demonstrate how to successfully administer IV medications and a piggyback. First things first, I'm going to go ahead and collect my orders and make sure that everything looks correct from the doctor. I then want to go ahead and once I go in to see my patient, I'm going to introduce myself. I'm going to give us privacy. I'm going to explain to the patient why we're giving the medications that we're giving. I'm going to ask for any allergies that the patient may have. And before I do anything, I'm going to make sure that I have the 6 rights, which is going to be right patient, right time, right route, right dose, right medication, and right documentation. So once I've done all of that and I've explained successfully to the patient what we're going to do, I'm going to go ahead and perform hand hygiene. I'm going to go ahead and put my gloves on. Alrighty. So first things first, the doctor wants 150 mLs of normal saline, and they want it over 60 minutes. I'm going to then do my piggybacked antibiotics of amoxicillin that we're going to piggyback on top of the fluids into the patient. So what we're going to do first, make sure we have the right medication. We already discussed the right routes, before we do any of that, we definitely want to check the IV site too to make sure that there's no redness, swelling, infiltration, pain to the peripheral IV site, okay? Whether it's here, wherever we have it. Okay, so the doctor wants 150 mLs. You can also check on the tubing. So this tubing I have here is how we're going to connect the fluids to this. It also has the drop factor on it as well that we're going to use in our dosage calculation. So we have the spike, we have the drip chamber, we have the clamp, and then we're also going to have the wide port. And then this is the part right here that should be going into the actual IV site. What we're going to do today is do it over a trash can so we don't get fluid all over the place. So once we have all of this, we want to keep this cap on the spike as long as possible so we can keep it as sterile as possible. So I want to go ahead and flip my bag upside down. This is the port right here that we can actually inject medications into if needed, but this is the side that we're going to use to spike. Okay. Okay. So we're going to take the lid off and we're going to just spike it. There we go. Make sure that this is off. This would be going into the, I'm going to prime it first, but alrighty. So I want to hook this up here. And then what I'm going to do once I get enough, I want to make sure that I prime the line so there's no air in the line. So I'm going to slowly release that. Take the cap off. Make sure that there's no air in the line. Okay, looks like that's good. Now what I want to do is I want to make sure that the drip rate matches my dosage calculation. So in my dosage calculation, it shows 150 mLs times 15 of the drip rate that it has on the packaging over 60 minutes. The doctor wants it over 60 minutes. So we end up getting 37.5, but we always round up. So we have 38 drops per minute that we want within the chamber. Alrighty. So this is where we're gonna check it. Get some out of here really quick. Too much in here. You can also tip it in this way too and put some more back. Usually want it about 1/3 to halfway full. All right, so now I want to go ahead and release the clamp a little bit, and I want to see if I can calculate. There we go. Okay, so then I'm going to actually time this for the minute. make sure that our minute matches the 38 drops per minute into this chamber. Okay, alrighty, it looks pretty good. All right, so now that we have this primed and good, then I can leave this as so. Okay, now what we're gonna do is we're going to look at our antibiotic that we have. So we have amoxicillin. The doctor wants 100 mLs times the new tubing, which is also 15 drops over 15 minutes. So we have 100 mLs times 15 drops over 15 minutes equals 100 drops per minute that we're gonna have in this chamber. So again, we really wanna make sure that there's no allergies, so we wanna ask the patient again if there's any allergies, just to make sure they've not forgotten anything just before we administer the medications. Again, we're gonna check the site just to make sure nothing's going wrong while the fluids are flowing. All right. So we have our new equipment, which is almost identical to the other. It has the spike, the chamber, and the clamp, except it doesn't have the whiteboard on this one. Okay, we're gonna go ahead and spike it. What I want to do is I want to prime this line too to make sure there's no air in it. Okay. Again, this would be much more sterile. Now that we know that this has gone through, I want to go ahead, now that it's spiked, I want to go ahead and hang this above the fluid, so that way gravity goes into the fluids and then goes into the patient. So we're going to piggyback this above. Alrighty, have this off. What I want to do though is I need to connect this to the Y port on here. So before I do that, I want to go ahead and make sure. Also, I did note that we want the fluids to be at least 30 inches above the patient for best results, best practice. So I'm gonna go ahead and clean this. Make sure we clean everything. Alrighty. Okay, now that that's in there, flowing. Now we want to calculate the drip rate of this one. Like I said before, 100 mLs times 15 drops over 15 minutes is 100 drops per minute within the chamber. So we want to make sure this one's going to be faster because it's 100. And again, you're gonna check this for 1 minute, for 100. Make sure. Okay, we're gonna make sure and say, okay, yep, that's 100. All right, so we're gonna let everything flow now. All right, if everything looks correct, we're gonna make sure everything is flowing, patient is comfortable, patient's not having any, discomfort or pain or anything like that. We want to make sure that we put the patient in a comfortable position so they can receive their infusion as best as possible. We want to throw away all of our trash, and we want to go ahead and document the best that we can. Everything is done, and we want to check on our patient as often as possible. Yeah. Okay. And then of course this would be hooked back up to the main line, so it wouldn't just be flowing everywhere. But yes, that's how we do it. Okay. Thank you so much.